After the recent measles outbreaks in Montreal, Vermont health leaders taking action, and they want parents to be on alert too. Local 22's Courtney Adelman with more on this story.
Patsy Kelso is the state epidemiologist for the Vermont Health Department. She says measles is one of the most contagious infectious diseases.
It can be spread through moist droplets from people who are contagious, or even through the air when someone with measles coughs or sneezes or even just talks.
And it can keep spreading.
Health officials say that in contained spaces in hallways like these, measles can linger in the air for hours.
Little particles can stay around in the air for a couple of hours after a person with measles has left a room.
According to the CDC, the 2-dose measles, mumps, and rubella vaccine is 97% effective. Some people are more vulnerable to the disease. One mom is concerned about her 2-month-old daughter, who is too young to receive the vaccination.
I think just having her being the vulnerable party is what makes it a little more worrisome for me.
Jill Mitchell says she is nervous because Burlington is a popular place that a lot of people come to visit.
But the truth is that Burlington is a popular tour destination for these people, for the surrounding areas, and I think that, having worry of an unvaccinated child is valid.
Kelso says getting vaccinated is the only protection.
In order to protect those people, we need 95% or so of everyone around them in the state to be immunized.
She says someone with measles is contagious for up to 9 days, 4 days before they see a rash and 4 days after.
We identify where that person was during all those 9 days and try and find all the people they may have had contact with.
As of right now, there are no reported cases in Vermont, but Kelso wants people to be aware.
While parents are taking their kids to healthcare providers over the summer, perhaps to get ready for going back to school, it's a good time to check with their provider and see if their kids are up to date on MMR and the other vaccines.
Courtney Adelman, Local 22 News, Burlington.
According to the CDC, the measles start with a cough and runny nose that turns into a fever. Now, symptoms can appear 21 days after someone is exposed.